Today on CityLine, a focus on health during American Heart Month, the healthcare leaders who are saving lives, and how we can all be heroes. When someone is experiencing cardiac arrest, every second matters. According to the American Heart Association, more than 350,000 cardiac arrests happen outside of a hospital each year. Research shows that only 1 in 10 of those people survive. That's why knowing CPR is so critical. Joining me now is Dr. Kemar Brown, a cardiologist with Mass General Brigham and volunteer advocate for the American Heart Association. Always good to see you.
Thanks for having me, Jessica.
So glad that you're here. We're on the ground for a reason, because you wouldn't do CPR on a bed, on a table. You want to be on a flat surface like this.
Yes, we want to be on a hard, flat surface. So whatever force you're putting onto the chest is actually going to the victim and not the surface underneath.
It's important to note, we are going to do a demo here in just a moment. We know CPR can save lives, but how can CPR outside of a hospital increase someone's chance of survival?
Yeah, absolutely. Delivering adequate CPR is actually quite important, and it can double or even triple survival once you're delivering CPR. Sometimes there's also hesitancy even starting CPR. So empowering folks in the community to go through it at least once so that they have the confidence to jump in when help is needed, I think saves lives.
I can understand the anxiety and the hesitancy, because it can be overwhelming in a crisis situation. So we're going to get to it right now. What do we do first when we see an event?
So as you pointed out, you want to make sure the victim is on a hard, flat surface. So sometimes patients or victims at home will pass out on a chair or even on a bed. You want to bring that victim to a hard, flat surface, right? At number one. You want to make sure that help is on the way as well. So if there's no one here to rescue you when you're delivering CPR, you're going to be doing it forever. So you want to make sure that 911 is on the phone or EMS is on the way, and then you want to get going. So hands should be placed, the heel of the hand should be placed at the center of the chest, sort of over the left side of the chest, which is where the heart lives. And your shoulders should be somewhat parallel to the victim itself. And then you want to start delivering adequate compression, so pressing on the center of the chest. And the cadence at which you're pressing should be about 100 to 120 beats per minute. And if we recall the song "Staying Alive" by the Bee Gees, that's one you could sort of sing in your head to get a sense of how fast to go. Us contemporaries may think about "Crazy in Love" by Beyonce, which could be a good one, another good one to use here. I noticed, Jessica, that you're bending your elbows. So you want to don't do that. You want to make sure that your elbows are locked in straight, and so that all that force.
That's a difference.
Yeah, all that force is directed to the center of the chest and not to the elbows. And essentially, the cadence is important. The depth at which you're compressing is also important, because with each compression, Jessica, right, we want to make sure that there's enough blood flow going up to the brain so that the vital organs are adequately perfused with blood. And we also want to give time for recoil, so the heart fills back up with blood. So let's try that again.
Okay.
Hand, center of the chest, and we're pushing. Very good. Those are beautiful compressions.
See, here's the thing. I think when you're doing these compressions, people have question about intensity, because, you know, we're practicing right now on this dummy, but on a real person, that can be overwhelming. So you do want to give a level of intensity. How do you know how much?
Absolutely. So in the community, we bring these practice mannequins, and it's particularly designed to click whenever you're actually compressing enough. In the hospital, we also hear those clicks when we're doing it in live action, and those clicks are actually ribs breaking. But those ribs will heal in a matter of weeks. We want to make sure that the victim survives the cardiac arrest.
And this could go on for quite some time. This is why you mentioned it's important to, you know, get 911 on the phone with you. They can also walk you through this, but this can go for how long in your experience?
So in the hospital, we're delivering compressions for 40 minutes, even up to an hour. You can be doing CPR. Outside of the hospital, right, you want to make sure if there's help around you, you may want to switch in and out every 2 minutes or so. but also you want to be the delegator. So you're going to have someone call for help. You're going to have someone get an AED device, which is an automated external defibrillator here, and put the pads on the chest. Once you turn the machine on, it gives you instructions. Pads on the chest. It will identify the rhythm as a shockable or non-shockable rhythm, and then it will tell you to press the button and stand back so that the machine can actually deliver electricity to the heart and rescue the heart from a bad arrhythmia. And then it will tell you to dive back into CPR if you need to. So all important, and the time can be lengthy sometimes.
Yeah.
So importantly, you want to make sure help is on the way.
Yeah, very important. I mean, you could, like you mentioned, 40 minutes. You might want to rotate with somebody who's also experienced in doing something like this. When would you know it's time to stop?
So, yeah, so when folks pass out on the floor, oftentimes they become unresponsive. And as the brain starts getting the necessary oxygen that it needs, the heart starts beating on its own, they'll start waking up. And they'll probably tell you, get off of me, right? So you'll see signs that they're now becoming responsive, whether it's movement, whether it's groaning, and that will be a point at which you stop. And hopefully there'll be EMS and other service personnel there to help sort of guide you along as well.
You know, so we just did a short demo here, but to get certified, to go through the training, it's going to take a little bit more time than this.
Absolutely. So as I said, we bring boots to the ground. We have been working with the AHA for many years now, bringing boots to the ground. And one session usually takes about 30 minutes up to an hour. I remember during the COVID days when we were all on sort of contact isolation, I was doing this over Zoom, right? Teaching about 40, 50 folks at a time. And it usually takes about 30 minutes or so.
That's not long at all,
yeah.
Right? And it can save a life. I want to talk to you also about the gap that exists when it comes to CPR training. You talk about bringing this education to people into different communities. What have you seen by doing that?
Yeah, we know that certain neighborhoods, even here across Boston, have longer EMS to victim time. There are higher risk factors as well for cardiac arrest, depending on where you live. And so having folks not only in the community, but in your home, practice and trained on how to deliver CPR is quite important. 1 in 10 survives, and we want to increase those numbers, especially in neighborhoods that are traditionally under-resourced.
Absolutely. You know, what have you seen so far in terms of the work that you're doing, bringing it to those communities?
Yeah, I can tell you, even in one training, whether it's training youth or even adults, elderly folks in the community, the confidence that folks leave with, right, every time we do one of these sessions brings joy to my heart and makes me think that we're doing a good job really rescuing folks and empowering folks in the community to rescue a loved one if they needed to.
So important. So how can we all best be equipped to save lives, whether that be in our homes, schools, public places, you name it?
Yeah, so we've been going across Boston with the AHA in churches and barbershops, training the youth in high schools to make sure that folks know what to do when the time comes, and if the time comes, and God forbid the time comes, right? We don't want the time to come, but if they needed to, they can actually save a life. We're also working at the legislative level, right, to make sure that high school graduates know how to do CPR before they leave.
Yeah, that's huge. Dr. Kemar Brown, we really appreciate you taking the time, showing us how to do CPR, educating the public. Thank you so much for the work that you do and for being here.
Thank you, Jessica.
Thank you. Well, coming up, understanding the disparities in heart health care, the parallels between underserved Boston neighborhoods and under-resourced countries around the world.